started. Welcome, everyone. My name is Mila Ferrer. I work at the Diabetes Link, and today we're going to be hosting a webinar in partnership with our friends at Blue Circle Health called Transitioning to Adulthood with Type 1 Diabetes, Resources and Tips for Success. What is the Diabetes Link? So the Diabetes Link is the only nonprofit dedicated exclusively to young adults 18 to 30 living with all types of diabetes, originally founded in 2010, and it was known as the College Diabetes Network, or CDN. In 2022, we rebranded to reflect on our expanded mission beyond college campuses. We connect young adults through peer communities, real-life resources, and both in-person and online support. Thank you, everyone, for being here with us. So today's speaker is someone truly inspiring. Her name is Carrie Matuzsan. She's a licensed social worker, certified diabetes care and education specialist, and part of the amazing team of Blue Circle Health. I see that we have Sarah, we have Scott, some of our friends from Blue Circle Health. Hello, everyone. She's also have been living with type 1 diabetes for over 21 years. Carrie will walk us through key aspects of transitioning from pediatric to adult care, navigating college and work, and how to build confidence and independence as a young adult with type 1. Hello, Carrie. How are you? Welcome, and thank you so much for joining us.
Thanks so much, Mila. Thanks for the introduction. And hello, everyone. Can share just a little bit more about me. Mila covered most of the points already, but my name is Carrie, and I'm a case manager at Blue Circle Health, which you'll hear more about as we go through this presentation. I'm in the Philadelphia area, and I thought I'd throw in another credential of mine in that I did go to college with diabetes. I went to Johns Hopkins University. And fun fact is I created the College Diabetes Networks chapter way back when it was called that, and back when I was in college. But let's see, a little bit of speaker disclosures, pretty much everything that I've said, that I'm a licensed social worker, CDC, yes, and also an employee at Blue Circle Health. So I wanted to share a little bit about Blue Circle Health in case that's something you've not run into yet before. The Blue Circle Health is a free and virtual program for adults living with type 1 diabetes. Blue Circle Health is a nonprofit organization, and we exist because of the generous funding of the Helmsley Charitable Trust. And this trust includes an inherent mission to help improve the lives of people living with T1D. We at Blue Circle Health offer free care, education, and support. And everything that Blue Circle offers to patients intends to close the gap between what people with type 1 need and what they get from our current reimbursable healthcare system. So quick disclaimer, just wanted to let everybody know that care for type 1 diabetes is very individualized. So everything I talk about is not meant to be medical advice specific to anybody, but please check in with your healthcare provider if you have any specific questions about your needs. All right, so today we're going to be talking about transition between pediatric endocrinology care over to adult endocrinology care. Transitions in big areas of life for young adults, such as being away from home, college, and work. Talk a little bit about or directly to the parents, if there are any joining us for today, and then a little bit more information about how Blue Circle Health ideally can fill in some gaps that she might run into. All right, so first, let's talk about preparing for the transition from pediatric to adult diabetes care. One of the most common questions that we hear is, when do we need to make the move? And the answer is, it really depends. The American Diabetes Association guidelines recommend that there is no specific age cutoff for youth who are making that transition over to adult diabetes care. So it's recommended to have a collaborative decision-making process between the young person with diabetes, their caregivers, and their pediatric diabetes care team. Be able to discuss their readiness, preferences, or concerns to help make sure that their transfer over to adult care aligns with their unique needs and circumstances, because there's lots going on during young adulthood. Ideally, the pediatric diabetes care team will implement transition readiness programs for youth that begins in early adolescence and at the very latest about a year before the transition between pediatric and adult care. These readiness programs should address not only diabetes self-management skills, but also bigger than that, looking at behavioral, social, and developmental factors. Multidisciplinary teams can be best. And by multidisciplinary, ideally we're covering physicians, nurse practitioners, certified diabetes care and education specialists, registered dietitians, behavioral health specialists, social workers, health insurance experts, and resources to help along the way so that their lives can be enhanced both with social and peer support. So if you're lucky enough to be part of a full pediatric diabetes center, ideally they'll have a transition preparation program already in place. However, if they do, they might have a specific cutoff. Sometimes it's 21, sometimes it's 18, sometimes it's a bit more open depending on the situation. But most pediatric healthcare systems do have a transition policy in place, just in general for even beyond endocrinology. So if this is a healthcare system that you're part of, be sure to check in and see what that cutoff might be so that you don't find yourself without care. Priority in presenting or in preparing for this transition to adult care is encouraging young people to be more effectively engaged in their healthcare and to become committed and active partners in the process. When looking at pediatric and adult diabetes clinics, it's really important to manage your expectations. Neither traditional pediatric nor adult diabetes healthcare systems are going to be ideal for unique needs of young and emerging adults. But you might be wondering what the difference is and why this transition is so important. There was actually a research study that examined the perceptions of young adults with T1D on their view between pediatric programs and the adults. They viewed the pediatric programs as more family-centered, informal, and more socially oriented. In contrast, the adult programs were viewed more as more formal and really having an emphasis on long-term complications and risks of these happening rather than taking a look at the whole picture. So as someone who has been through both of those, and I used to work in pediatric endocrinology, I agree with this kind of distinction. And would say that that's something just to keep in mind if you're making a transition from the more family-oriented pediatrics group over to a more individual focus with the adults. While the endo over in the pediatrics, they'll also include caregivers and family members in all the decision-making and self-management considerations. Adult endo is more likely to expect the person with type 1 to be making those decisions and asking questions independently. So some practical tips for making this transition is one thing that you should pay attention to is that the age of 18 is very important. Once a teen hits 18, that's going to be a cutoff. And that if parents are in the picture, if other adults are in the picture, you're going to lose access to the information unless the 18-year-old is signing a release of information. And that even goes for electronic medical records. Like if you had an access to their MyChart, you might lose that unless there's that additional form signed. So if continuing on as a more family-focused care is something that's important to your teen, make sure that that form is signed ahead of their 18th birthday. And if you're going to be making that transition from pediatrics over to adults, by the time that you get to what is ideally your last visit with the pediatric provider, be sure to ask for a whole year's supply of refills with insulin or any of your supplies, just in case that transition extends a little bit further than you want it to be. So make sure that you are requesting for your records to be sent, but also stay active within your health portal, because if you get to the new appointment and you find that you need a little bit more information, having access still to that health portal can be a great way to reduce the steps and not have to request all of your medical records again. And if your pediatric endo team is making a referral for you, make sure that you're also getting that contact information, getting the name, the location, that phone number, just in case you need to follow up on that referral and say you don't hear back from the adult endo right away, that you can reach out and be a bit more proactive in getting scheduled with your new patient appointment. Also be sure to check in with your DME supplier or your mail order pharmacy if that's something that you're using for CGM or pump supplies. Make sure that they're updated with that new doctor's name so they know where to send that request if a new prescription is needed. And then what to expect when your pediatric endo sends a referral over for an adult endo. That really depends on what area you live in. There could be some long wait times getting established with the new patient appointment. It's frustrating, to be completely honest, and how long it can take for that new patient appointment to happen. So be sure to check in with your pediatric provider and see if one more visit is an option in the event that that new patient appointment takes longer than expected. Or you can even pull in your primary care doctor and see if they're able to support you with an interim visit just to make sure that you're covered with all of your prescription needs. All right. And then some healthcare considerations. When you're first going over to a new adult endo, keep in mind that it can take a little while to build up a new relationship with that healthcare provider. Ideally, it's going to be one that's based on mutual respect and trust. However, that can take some time to get established. And part of developing your independence is learning to ask questions, advocate for yourself, and respectfully express your opinions. So, if you think that this new healthcare provider isn't a good fit for you, just know that you can request to see a different provider, especially if there are multiple within the practice. You're also empowered to take charge of your diabetes clinic visits. And it can be really helpful to keep track of 4 main points when going into a visit. So I like to keep my notes in just my phone, like my phone app. So that way, as a new topic comes up, I can pop it in there and then I don't have to think as much going into an appointment. But 4 topics are practical matters. So things like prescriptions or letters for accommodations or travel, any advice that you might need about new technology. Diabetes matters as an even bigger picture than just how do I manage my blood sugar, but things like how does alcohol affect your blood sugar? How do you manage your insulin pump if it's beeping during class or when you have a roommate? Mental health matters are something that unfortunately don't make it into every conversation with the doctor. So be sure to speak up if you feel like anything is feeling off, if you're feeling anxious, any thoughts with depression, or if you just want to speak with somebody about your mental health, don't hesitate to ask for help. And lastly, prevention. Ideally, these adult endos are going to be focused on prevention of any complications, but just be sure to double check that you're getting all of the follow-up exams that you need, like eye exam, foot exams, all those fun things that the endos recommend yearly. All right, and then I just added another one on here for reproductive health. This one is near and dear to me as I've done research in the past, and which is actually still kind of common for people to be, or for young women especially, to be told that it's not safe to have a baby. So just a reminder that healthy pregnancy and newborns is thankfully within reach for most young women with type 1 diabetes. So if this is something you're concerned about or want for the future, be sure to bring it up with your doctor and make sure that you're all on the same page. All right, so that's kind of it for the medical stuff. And right now I'm going to be talking more to the young adults. I'll talk directly to the parents in just a few slides. But moving on to those big life transitions, moving away from home is a huge one. And whether you're moving to college, to an apartment with roommates, or living alone, this is all going to require some big adjustments. For one, you're not going to be around as many people that you know as well as your parents, or you might even be spending more time alone than before. So for one, try to find, if you don't already have one, a good medical alert bracelet or necklace that works for you. And hopefully you never need it, but it's a key bit of information in the event of an emergency. It'll be very helpful if you are around people that don't know you as well or who aren't as familiar with type 1 diabetes. As you meet new people at school, at work, or just in the area that you're living, talking about your type 1 can be a really good way not only to keep yourself safe, but to be open to more meaningful relationships. However, it doesn't mean that everybody needs to know everything about your T1D. So that's really going to be up to you on how much you share with people. Some people might only need the basic knowledge of T1D, like that you have it, that you take insulin, that you can eat sugar, and that you're doing okay. But other people, all up to your discretion, whether it's your roommate or a significant other, should probably know some deeper details, such as low symptoms, where your glucagon is stored, how to use it, when it's appropriate to call 911. All of these details with those people who would be the most important in your life or will help keep you the safest. No matter where you're living in young adulthood, taking on T1D responsibility is a must. There's a lot to learn, so starting before you're out of the house will make understanding and putting everything into practice a lot easier. So check in with your parents or other important adults or doctors to make sure that you have a good understanding of what goes on behind the scenes of a healthy life. That could be medications, how to navigate the pharmacy, how to order your diabetes supplies, how to schedule your medical appointments, keep track of those appointments, and the really big topic of health insurance. So health insurance can be really confusing. There's a lot of information that's specific to your individual plan. So aim to find out early on some key bits of information, like where your insurance card is, what your deductible might be, or how to find out this kind of information, such as your online portal. Another important one is having a sick day kit made up before you need it. I like to include things like low snacks, actually really everything that's on this picture. So low snacks, ketone strips, water, Tylenol or Motrin, cough drops, protein bars, soup, whatever it is that you think that you'll need. I can tell you from experience that it is horrible to be sick and away from home and trying to find something to eat. So just pull it all together ahead of time and just make life a lot easier. All right. And then last one for this slide is mental health. So there's a lot of big changes that are happening at this point of your life, and that can bring up a lot of emotions. Mix in changes to your support system, to your routine, maybe access to your coping strategies. And it's completely valid for mental health to need some extra attention. So be sure to check in with yourself frequently, so you might need some extra support moving forward. If you find that you do need that extra support, colleges often offer free or reduced cost counseling services on campus, and many employers offer an employee assistance program or an EAP that include either those services or resources. All right, since we touched on campus life a little bit, just wanted to focus over on college for this slide. As you narrow down your list of colleges to look at, or ones that you've already been accepted to, consider more than just the academics. Ask some questions that are important to your care, such as how far is it away from home? What kind of health services are available on campus? How might the mailroom handle an important package like insulin? Where the closest pharmacies are? And also everyone's favorite topic of just what can I eat? So those are all big things to consider as well. Another big one that I don't think I fully took advantage of in college, looking back on, I wish I had, was signing up for the disability services. The colleges offer disability services, in which I had a definition from Johns Hopkins where I went that said that a person is considered to have a disability if he or she has a physical or mental impairment that substantially limits one or more major life activities, has a record of such an impairment, or is regarded as having an impairment class. It's a very broad topic, but that means that T1D easily fits within it. And getting connected with the disability services allows you to be able to request accommodations to make life a little bit easier when you're on campus. You might be able to ask for anything that you need with the support of a doctor's letter. And Diabetes Link actually has great resources for learning what kind of accommodations you might qualify for. They could be as simple as indoor fridges, and then going into class life, ability to check your blood sugar when needed, taking breaks from tests if your blood sugar is out of range, rescheduling exams, or even just the notification for your professors that you have type 1. Even if you feel like you don't need these accommodations, go ahead and sign up anyway, because it'll be a lot easier to use them when they're in place than trying to go back and request them once they're needed. I tell every young adult that's heading into college to check out to see if their college has a Diabetes Link chapter. So it's a great space to be able to meet other people on campus with T1D and learn about what kind of hacks they've already figured out when it comes to college life with diabetes. Outside of disability services, I recommend trying to schedule your college classes around your personal needs. So I, for example, when I was in college, I got a CGM about halfway through college, but for the first half, I knew that blood sugars in the mornings could be really rough. So I made sure to schedule my classes around that and make sure I had as few early morning classes as possible. And for those few ones that I couldn't get out of, then I could put all my energy into those few nights a week leading into a morning class instead of making every single night that focus and adding extra stress. And then another big part of college is the social life. Finding a balance between social life, academics, and type 1 can be a challenge. So just expect to have some stumbles along the way. And that's okay. Check out all of the resources that Diabetes Link has to offer, because I recommend them frequently. And if you qualify for Blue Circle Health, we can help you as well to make sure that you can get through this time in life as smoothly as possible. All right. So whether you're going to college, graduating, going to work, or going straight into the work world, there's still a lot that you can focus on. Um, Starting a new job can add a lot of changes to life. Diabetes burnout is common as there are so many changes that are going on at the same time. So be sure to consider how your support system, whether that's your family, your friends, your healthcare team, anybody else in your life, see how they can assist you with that load. And consider what you can safely back off of during this transition time. It's impossible to give 100% to everywhere. Uh, so looking at the employer, try to be open if you can with your manager or your boss early on, as this can help ensure your safety as well as reduce the questions that might come on later. Your boss might not know a lot about T1D. Providing information about what this means for your work performances and needs allows you to lead the type of information that your boss is getting. If you're not giving that amount of information, it's really going to leave room for your boss to go off of assumptions or maybe even some poorly Googled information. And importantly, show confidence when you're talking about your T1D, as this confidence can really put others at ease and let them know that you know what you're talking about. If you have any concerns about that, also know that there is the Americans with Disabilities Act. It's a federal law that prohibits discrimination against qualified individuals with disabilities. It's a really long document and there are a lot of titles to it, but I just pulled some key information on how it relates to employers. So for one, you can't be asked about medical conditions before a job offer is made. You can choose to share some more details about yourself or about T1D, but that potential employer is not able to ask more about the condition, your treatment of it, or even how T1D is going to affect your workability. Your employer can't rescind a job offer due to a disclosure of a medical condition. They can ask for some additional documentation or even a physical, but only if that's something that they would do for any other applicant for the job. Most importantly, once you're hired, the actual performance is the best measure of your ability to do the job. And you can use reasonable accommodations if needed, as the employer is going to be required to allow them in place as long as it's not adding a huge financial burden to the company. Some reasonable accommodations can include things like taking time to check blood sugar, a private space to check or give any insulin, permission to keep food nearby or the testing supplies nearby, making some modifications to your schedule so that you can attend doctor's appointments or treat out-of-range blood sugars, or even changes in break time in order to recover from an out-of-range blood sugar. Doctors are allowed to ask for supporting documentation for any of these accommodations, but that should just be a very simple letter coming from your doctor. All this medical information that you share with your employer and accommodations are confidential. They can't be shared with other employees. And another important part is that harassment is not allowed in retaliation for any use of accommodation or making reports of harassment. Those are all prohibited acts. So there's a lot more to that act, but these are some of the key ones that I think a lot of people aren't aware of when they go into the work world. I want you to be able to confidently go into the type 1 or into the work world with type 1 diabetes, stay safe and healthy. All right, so with these next two slides, I'll talk more to the parents. So young adults, you can shut off if you want to. But for parents, just know that this transition from you as the driver to your team being the driver for a type 1 diabetes care should be gradual. So if you practice type 1 diabetes skills, even simple ones probably feeling to you, such as scheduling appointments, navigating health insurance, refilling prescriptions, and navigating blood sugars, those all require some practice. So I'd encourage you to do that over a couple of years. Health insurance is a very difficult topic. I work with it, and it's still confusing. So just be mindful that it could take quite a few rounds of the terminology before your teen is able to understand it. And letting them know what's important to look for with the health insurance can help them as they're picking a new plan. With a lot of young adults being kicked off from their parents' policies after 26, the next plan is going to be really important. And if you've given them that base information, it can really help them to choose what's going to be best for them. I also refer a lot of people over to the Diabetes Link Resource Hub for Health Insurance 101. I think that's a great resource to get started and make sure all those important points are covered. I did add a quote here that's kind of long. If you read it so far, want you to know that the goal of adding this is to show you how common the concerns are for teens and young adults not doing as well with their diabetes in this time. Is not just your child if you feel like yours is not doing the best. It's so common that the American Diabetes Association and their standard for children and adolescents, their standard of care actually wrote it in. So just keep in mind, it's not just your child. And many of us, myself included, have gone through teenagehood, young adulthood, and adulthood, and are still thriving. So I promise it's possible. The standards also go on to say that resources to enhance social and peer support during this transition process may be valuable. It's vague, but it's a good starting point to encourage you to check in with your child about just how much input they want from you in finding resources. All right. And then continuing on with your role this time, try not to be the diabetes police. Instead, aim for open and honest conversations with your teens and young adults. With responsibilities for type 1 diabetes, there's a lot to remember and a lot to do while managing a normal life. So be sure to give your child some grace and just ask how you can be helpful. Making good choices is required between balancing type 1 and young adulthood, and there's plenty of room to stumble, but there's also plenty of room for them to get back up. So just remember that your teen is just a regular teen who happens to have type 1. Conversations about data sharing, boundaries, and trust is really important, especially as devices are improving and sharing is something that's even more and more common. So just consider asking yourself, like, when is it okay to check in on CGM readings, discuss that, and come up with a shared number of basically of how often you should be checking in on your teen, how often you can ask about their supplies before it gets too annoying for them. If you feel like you need some more structure with this, check out the Family Communication Agreement document, also on the Diabetes Link Resource Hub. I do refer people over to the Diabetes Link very frequently because you have wonderful resources. All right, so I talked a bit about Blue Circle Health, so just wanted to give you a little more of an overview. As I've shared, young adulthood is challenging for everyone, especially so for people living with type 1 diabetes. We don't want them to fail at all. So with that big transition, we're hoping that Blue Circle Health can also help you out. So like I mentioned before, Blue Circle Health offers a program that ideally can fill in the gaps of care that can happen during these big life transitions. So I mentioned it's a nonprofit organization that provides free type 1 diabetes specific care, education, and support. We offer a number of services. All are free and all are virtual for up to 6 months in 11 states, with our newest of Louisiana just launching today. So if you haven't seen that on social media, but we're hoping to expand to new states soon. All right, and then I just included a quote from one of our college-age participants, found that navigating insurance and just support from Blue Circle Health was very helpful for her in this time. All right, I'll hand it back over to Mila.
Carrie, this was amazing, and thank you so much. One thing that I want to remind everyone is that we are going to be sending you via email the recording and the slides that we are seeing tonight, so you can use them as resource. We have some links that are live that you can click on, and you can go ahead and utilize. I've got a few questions for you, Carrie. This is a great topic. This is an experience that my family went through when my son started college in 2021. So I applaud you because you were spot on, like communication, having a plan, being very organized, and also, especially for me as a mom, like trusting your kid, letting them know that, hey, you are on your own. We trust you, but if you need anything, we are here to support you. I think that for us, it has worked great. So I encourage every family to have those conversations. There's going to be days that are very challenging, and you're going to be like, oh my God, this kid is driving me crazy. Like, he needs to be back home. We need to have a chat or something. But that's part of it. With or without type 1, that's going to happen. So breathe in, breathe out, everything's going to be fine. Carrie, you mentioned that in the emotional transition from pediatric to adult care. What was for you that personally? Because you mentioned that you went through college with diabetes. How was that experience for you?
I had a slightly different route in that I started out adult endocrinology by accident. So I was 12 going into it, and we just weren't told that pediatric endocrinology was a thing. So we were just, released from the hospital. And my mom knew of one adult endo, so she called him, and I was his youngest patient by at least 20 years, probably more. So I felt I was spoiled. I had his phone number, so I would call him throughout college as I needed things. However, my first big girl job coming out of grad school was in pediatric endocrinology, so I got to see itty bitty babies grow into teenagers. Not personally, but I saw all the whole age range, and then helped to come up with a program that helped them to move from pediatric over to adult. So I did see quite a bit of that emotional side, and it definitely ranged from the people who were very attached to the pediatric endo team, and sometimes it was the parents who were being dragged out of the pediatric clinic more than the teens. So it was just so interesting how different it was for different families, depending on just what their trajectory was with type 1 diabetes through childhood. Oh, you're still on mute.
I'm sorry. Thank you so much. And thank you for that answer. We all know that managing diabetes is very overwhelming. And when you add life transitions like going to college, starting a new job, that can make everyone go like, oh my God, I feel like my hair is on fire. What are some tips that you can provide to someone when that young adult it's back in college? He's like, okay, I'm on my own. I have to study, I have to manage my diabetes, I want to have my social life. But they're like so overwhelmed that they don't know how to organize or where to start. Any tips for that young adult?
That's a very good question. I think for that, even if we take type 1 out of the picture, I'm going to give kind of the same advice of just lean into the support system. Like if you're feeling so overwhelmed, no matter what fill in the blank it is, if you're feeling overwhelmed, see what part you can outsource to someone else. I talk about diabetes burnout a lot to teenagers. And when it was focusing just on diabetes, it was like, okay, great. What can we take off of your plate and give it to someone else? Like, can we have someone else follow your Dexcom? Can we have somebody text you to check in on if you bolused for this? Can we have mom ship the insulin? Whatever it is that feels overwhelming until that they can feel that they're in a spot where they can gain some more control. And then as they gain up their confidence again, then they can start taking some tasks back.
Amazing. That I think that's very similar to the plan we had. Like all the my son's supplies were being shipped to our house. And then he would keep us posted, like, hey, I'm running low on these or that. And we would make sure that he would receive them. I do have one final question for the parents. And this is a question that personally, it took me a while to like have through that stage. Any advice to those parents, like I was at the beginning, who want to support their kids without overstepping? Like when it's that time where we as parents have to say, okay, I need to sit back. I need to just observe and see what's going on. As an example, the first month when my son started college, it was very hard for me. But at one night, I said, you know what? I just need to watch. We have access to his CGM, so I'm just gonna watch what's happening, and then if things are not getting better, I'll call him. But we just waited. His blood sugar stabilized. We talked to him, and then when we asked him what you did, he managed it like a pro. And then based on that, we started like, okay, let's not be on top of him so much and let him figure out things. His ways were not my ways, but it was working. He was safe. His blood sugars were okay. And that's something that it took me a lot to understand. My son was diagnosed when he was 3. So for many, many years, my son and I were the caregivers. And when you find yourself like seeing how your son or your daughter is managing their type 1, which is not how you would manage it, but if it's working, that's fine. It's their type 1. They have to learn how to make sure it fits into their lifestyle. You have to just step down and say, hey, let me know if you need help. We are here. It doesn't matter the time, but just let them know and provide them that trust that, hey, you got this. You're going to be able to do it. So, what advice can you give to the parents that are like super scared? Like I was at that at some point, and just ease them a little bit into this big transitioning of having their kid moving far from home.
Yeah, that's I hear where it's coming from, a big worry, especially since you've done such an important job from your son's very young age. So you took on a lot. So one, thank you for doing all of that. And thank you for probably saying it on his behalf too. Thank you for just knowing to step back a bit. It's very easy to be that helicopter parent for far too long or not really teach your child, in which that's really only just going to be a detriment to them. Because as you said, I love that of that's their type one. They have to learn how to do it. So as a parent, if you end up managing it all the time and they don't learn, then they're not going to know how to take care of it. Oftentimes I refer back to like the toddler stages. So for everything that you're getting your teen ready to do, even outside of diabetes, like they have to know how to do their laundry, they don't have to take care of themselves, they know how to clean the house, all that stuff that you have to teach them. So think back to when they're toddlers and how many times you had to watch them fall down or fail doing something just so that they could learn. Unfortunately, type 1's going to be the same thing. So I really love that story that you had about the low. If people are feeling nervous about experiencing that when they're outside of the house, try it when they're younger, maybe when they're 16, 17. Try that scenario of just not going into their room and seeing what happens and doing that trial, but being in a safe spot, just to see, what your child's going to do on their own. Sometimes just allowing that practice time is going to help them to learn, and that way they also know that they're safe. If you're just in the next room over, that they can ask for the help if they actually need it.
Amazing. And also one thing that us as family and this is something that I recommend to everyone. Like every time you're talking to your child with type one, remove type one out of the conversations because what we want to make sure is that we have open conversations and open communication with whatever topic it is. And if we become helicopter parents because of their type one, they're not going to be coming to us to ask us important questions, like talking about their problems, the challenges they're having, because they're going to be like, oh my God, I need to talk to my mom. I need to talk to my dad. They're going to be asking me about if I want to go to a party, they're going to start like, hey, remember, don't drink, blah, blah, blah. So we want to make sure that we try to create that safe space for them to be able to come back and say, hey, this is my plan. I want to go on spring break with my friends to, I don't know, Cancun, which I know every parent's going to be like, oh my God, Cancun. No, like everyone's going to be freaking out. But we want to make sure that you are comfortable enough to say, go ahead. Let's check. Let's make sure you have enough supplies. Let's make sure you have everything. What's the plan? What are going to be the communications that we're going to have? If you need anything, like anything that you can think, I think planning ahead, it's very important. Ari, thank you so much. These questions are very amazing. And I hope that your responses and some of our story can help other families. Carrie, if you can go one slide back, I
I
want to
can.
say thank you.
You go.
So I know that I already shared on this chat a few links for caregivers and some others that are directed to young adults for the off to college process. We want to make sure that you have as much information as possible. And Carrie has done such an amazing job sharing like all the resources we have. But on that link, and when you receive the slides, all the resources that we listed here, those are hyperlinked, so you can go ahead and visit them. We want to make sure that you as a family feel comfortable, feel secure. And for the young adults, we want for them to be excited about this new stage that they're going to be leading. And we want to make sure they have the best time of their lives. College is just a once in a lifetime experience. And we want to make sure that type 1 diabetes or type 2 diabetes, doesn't matter the type of diabetes it is, that it's not something that they're going to be like looking back and saying, no, I didn't enjoy my college years because I live with type 1. That it's not true. We know so many young adults that are thriving, enjoying their college lives and being and taking care of themselves. Once they're done with college, they're going to go to find a new job. They might be moving out. And then after that, they might be planning to start a family. So we as parents, we need to make sure that we are on top of all the resources. And if we notice that they are not having access to those resources, like every once in a while, send them this link like, hey, keep these for the day that you need this information. Carrie, I want to ask you something about Blue Circle Health. I do know, and this is something that it's very important for parents. Once your son or your daughter is planning to go to college, as you know, and as you mentioned, they might need to have a different endocrinologist. How can Blue Circle Health support college students in the states that you are located now? We all know that it's not easy to find an endocrinologist. Sometimes appointments take forever and we might need something or a support for that transition. How can Blue Circle help us?
Sure. Let me go back to this slide. So this one lists all of our services. So I think some really key uh, information for how Blue Circle can help out with these kind of situations, especially if as people are moving around, as life is changing. One, that it's virtual, and two, that it's free. I think those are two things that help to make it a bit easier to attend an appointment compared to an in-person endocrinologist. And you're also not dealing with copays, or actually, you don't have to give us your insurance at all if you don't want to. And that helps, I think, to eliminate some of the barriers. We do have quite a few services that can help out. So, say that you're trying to get into an endocrinologist, and you might have a 6 to 9, maybe 12-month wait list for a new patient appointment. Our endocrinology team is able to see people considerably faster, sometimes even getting in within the same week, maybe the next week if needed. But once you're signed up, we're able to access as many services or as few services as you would like. So with this full circle that I have on the screen here, it shows quite a few of all of our services. And even if people are traveling in between the states, like Mila, we were talking about this, and if you're happen to be traveling between two states that we do offer the service in, you're able to go seamlessly and not have to worry about being limited by the in-person endocrinologist or their licenses, as long as you're within one of the states that we have service to. And we're continuing to expand. So hopefully you're in some of these states, and if you need us in a different state, that hopefully we'll get there very soon. But yeah, and then some people don't even need the endo services. Some might just need our T1D support guides who have diabetes, so they can talk about what it's like being, just having life with type 1 diabetes. So diabetes supportive counseling, which is short-term counseling that focuses on living with type 1. As the case manager, I help out with everything else that's going on in life. So if you're running into concerns with managing health insurance or having access to important things like food or housing, those are some of the areas where I'm able to support you with. We also have insurance navigation that help people to understand a very confusing topic. We have some assistance when it comes to CGMs and prescription assistance. We have our diabetes educators who can support just how to manage diabetes and also talk on the nutrition side. And I do believe I have touched on all of the circle, not in the right order, but those are some of the ways. And I also have some of my team here in case there are more questions that I'm not able to answer about Blue Circle Health.
I do invite everyone to follow their social media channels. They do provide webinars that are open to everyone, so please join them. They have cooking classes. They have diabetes management topics, so it's very interesting. And even if you're a parent, I think it's always good to keep our knowledge refreshed. And for young adults, if you are starting to plan, oh my God, I'm going to be cooking for myself. What can I cook? I don't know how to cook. Join one of the classes or watch them once they're recorded. It's going to be great information. Oh, let me see. I have a message here's a link. Scott was graciously enough to share the link for the upcoming events for Blue Circle Health. So please join them. Amazing. Carrie, can we go to the slide with the Discord channel information? So now we want to talk to young adults. We know that probably the topic that you want to talk the least is about your life with diabetes. But one thing that we have learned and I have seen in my son is that knowing and getting to share his life and learning from others who live with type 1, it's a life-changing experience. That's how I met Scott many, many years ago. That's why I love and I'm so passionate about community because I have seen the great advantages and benefits. What we want to do with the young adults is, hey, go to your phone, download Discord, and join the community. We have an online community, a community that is only for young adults 18 to 30. No older adults are there. It's managed by young adults living with type 1 or living with diabetes. And it's all for you. We want to make sure that that's your like sacred little secret space for you guys to talk about the topics that you need to talk. Go ahead and ask questions, share experience. If you're looking for internships, we have a place specifically for that. If you have an upcoming job interview and have questions about how to talk about your diabetes, we have a special group for that. So we want to make sure that you can go there and you can ask as many questions. It's an online community. It's on Discord, which is like the cool young community. Of course, when I saw it, I'm like, yeah, I know that my kids use it for gaming, but if that's what the young adults are doing, let's go ahead and do that. We also have TikTok because we know that learning through short videos, it's very engaging. And our team does an amazing job of creating very young and engaging content for us. And also we have Instagram. Parents, you can also join us there. There we share information, we share stories about our young adults, and we're always sharing our next topics. For example, our next webinar, which Carrie talked a little bit about it, it's about the accommodations that we need to request. And that's going to be in October. It's going to be with our friend Annie Tolkien. She was she was a speaker at our last webinar. And we want to make sure that every time that you're thinking about college, you think about the accommodations. As Carrie mentioned, she's like, I wish I had done that when I went to college, but it's very important they do it because it's going to help them and it's going to pave the way for them to have a better college experience. So once again, Carrie, thank you so much for joining us. I'm going to be sending this recording probably next week along with the slides. Thank you to the Blue Circle Health team for making this possible. Scott, Sarah, everyone who's here today. And please visit us, follow them if you don't know them. Any closing words, Carrie?
Yeah, I just want to thank you so much for having me, for allowing me to share with the bigger diabetes link community. Again, I promise you can do it. I got through young adulthood, and I know that many of us here have all gotten through young adulthood, so it feels like a tough time in life, but I promise you'll get through it.
Amazing. Thank you, everyone. Have a great summer and see you in October for our next webinar. Thank you, everyone.
Thank you.
Bye-bye.